And welcome to our Lunch and Learn here at the St. Genevieve County Community Center. We are pleased that you're here today and taking a vested interest in your health. We'd like to see that. Our guest today for our Lunch and Learn is Mary Crecelius. She is a nurse practitioner in our Women's Wellness Department, and she's recently, over the past year and a half, 2 years, I guess, close to now, been taking extensive course study in genetics and breast cancer risk assessment. And she recently just received a new certification. She is one of only 3 in the state of Missouri that has some certification, and you'll tell us what that is. But we're very proud of her and glad she's working for us here at St. Gen Hospital. So without further ado, Mary Crecelius talking about breast cancer risk assessment.
So I'm excited to be here, and I know quite a few of you, and it's a really small, intimate group, which I really enjoy speaking with. And so as I talk, if you have any questions, just raise your hand, or if you just want to shout them out, that would be great. And so I did just get my advanced practice of nurse genetics. I'm a women's health nurse practitioner, and I have an area of interest of hereditary breast and ovarian cancer. And at Bloomsdale, I work with Dr. Teresa Caven. She's our breast specialist. She was at Mercy Health Center for 15 years and was one of their top docs, and came to Bloomsdale because she grew up in that area and has created a really amazing breast program. And so I work closely with her, and our goal is to be able to one day look at families, look at women, find risks that we are able to detect and prevent, or detect breast cancer at a really early survivable stage. So it's a new world out there, and genetics is a big part now of risk assessment in our breast cancer patients. And so today, again, I'm going to be talking about identifying and managing hereditary breast and ovarian cancer syndrome. And the 2 specific genes I'm going to talk about are BRCA1 and BRCA2. And we all have BRCA1 and BRCA2 genes in our bodies. Men and women have them, and their role in our bodies is to suppress tumors. So I worked on this for a year and a half, and I had to create a big portfolio, and I talked to my family all the time about what I was doing. I was working with the BRCA1 and BRCA2 gene, and everybody would promptly go to sleep and didn't want to hear anything else about it. And then one day when I was leaving for work, my 22-year-old son said, "Mom, did you hear Angelina Jolie has the BRCA gene?" And I'm like, "You're kidding, you're interested now?" So it was really exciting when she stepped forward and kind of gave her story to the media. And so she had a mother who had ovarian cancer and died from ovarian cancer. And I was never clear from the lovely medical journal of People magazine that Angelina Jolie's mother was tested for the gene. But her aunt developed breast cancer. And so it was determined in this family that there was a mutation in one of the BRCA genes. And so when it was found out that there was this mutation, Angelina went and had the test, and she was found to have a mutation in her BRCA gene. And so she took the step of having a preventative mastectomy and reconstruction to really reduce her risk of breast cancer. And so we've had the Angelina effect. And so now people are suddenly interested in hereditary breast and ovarian cancer. It's been pretty exciting. And this is Dr. Powell. He's up at Barnes, and he's a gynecologist, oncologist, and he works a lot with ovarian cancer. And you can see, probably not as clearly as I can, but the recent St. Louis magazine says Dr. Matthew Powell on what we can learn from Angelina Jolie. So she's just penetrated everywhere in this world of hereditary breast and ovarian cancer. So another exciting thing happened about a month ago in the Supreme Court. A big decision was handed down, and there used to be only one company that offered a test for the mutation in the BRCA1 and BRCA2 gene. And it's a fairly expensive test, and the Supreme Court said that nobody can patent our genes. And so now we've had an increased availability of testing options, and the price is going down, so that's been exciting. And this is just a little cartoon I found, and the man is saying they're our breast cancer genes. We identified them. Well, that's the company that was at the Supreme Court. And the woman said, it's kind of you to let us have the disease for free. So again, it was a big victory, and we now have expanded testing options, and that's been exciting in our office. And the only point of this slide is we have healthcare reform, and one of the preventative care services that's covered under the new healthcare reform plan is risk assessment. So you have to check with your insurance, but most insurances now offer a visit with a specialized practitioner to do risk assessment and take your family history. And so it's considered a preventative visit, and there's no copay, and that's pretty exciting. The other thing that people are worried about is if they have this test and they're found to have this gene mutation, will they be able to be discriminated against? And will health insurance people say to them, you can't have health insurance because you have a mutation in one of your BRCA genes? And there's a federal law, GINA, it's the Genetic Information Knowledge Act, that makes it a federal offense to discriminate against people who have a genetic mutation that makes them more likely to get a disease. So what do I look at in families? When I see a woman come in and I'm looking at her family history, I'm going to go over some of the things that make it more important to think about looking at your family and looking at you to see if we need to test you. So this is a really complicated slide, and I'm not going to go through all of it. But recently, the group that gives us our guidelines, they're called the NCCN. We used to look in families in both the male and the female or father and mother side for breast and ovarian cancer. And we've recently found out that aggressive prostate cancer may be caused from a mutation in the BRCA gene, and pancreatic cancer may also be related to a mutation in the BRCA gene. So it's really important to gather information from your family histories on who had what and at what age did they have this disease start. So some red flags for hereditary breast and ovarian cancer include any ovarian cancer. So ovarian cancer is rare enough that when it occurs, we really think about, is there a mutation in the BRCA gene? And so if your family history includes an ovarian cancer, that's a red flag. We want to talk about your risk. Breast cancer diagnosed before the age of 50. If somebody's had 2 primary breast cancers, so they were diagnosed with breast cancer, and then a couple years later, they got another breast cancer. Not a recurrence of the same breast cancer, but 2 different breast cancers. Anytime we see a family with male breast cancer, that's a very big red flag for a mutation in the BRCA gene. When they diagnose breast cancer, they give a pathology report and they test to see if the breast cancer is sensitive to hormones, estrogen, progesterone. And if you're told that your breast cancer has no hormonal receptors, or that it's a triple negative breast cancer, that's another red flag that makes us think maybe there is a mutation in the gene. Your ancestry, as far as there are some cultures that have a higher incidence of the mutations in the BRCA gene, and Ashkenazi Jewish population has a really high incidence of 3 specific BRCA mutations. We talked a little bit about pancreatic cancer. If there's a pancreatic cancer in the family and maybe a breast cancer, that's a really big red flag. And then it's really interesting to me, every once in a while I meet a woman who says, oh yeah, they did talk about that there's a breast gene mutation in my family. If you ever hear in your family that somebody has tested positive for a mutation, we really need to test you for that mutation. So it's so important to talk to family members and ask what Aunt Alice had or Uncle Raymond had. And when we look at family histories, we look at your brothers and your sisters, your children, your parents, your aunts and uncles, and your grandparents. So we go back to the grandparents' generation. And it's been surprising to me how little people often know about their family histories. And so they might say, well, yeah, I think there was a cancer in the family, but I'm not really sure what that cancer was. It's becoming more and more important to identify what has been in your family. So we used to think maybe with breast cancer that we only needed to worry about the mother's side of the family. So I can remember when I did family histories, I would say, oh, I just want to know about your mother's side of the family. That's the most important side for breast cancer. But this gene can come from either the father's side of the family or the mother's side of the family. And this kind of identifies that this father carried the gene. And in men, maybe we're not going to see the expression of that gene. So maybe they're not going to get prostate cancer until they're in their 70s or later. But we still look at that father's family history. And in this family, it was the father that had the gene. And so the children have a 50% likelihood of having the gene if their parent has the gene. If a parent doesn't have the gene, but say the grandma in the family had the gene, but it did not pass down to that parent, it can't skip a generation. So if your parent does not have the gene, then we don't think you will be at risk to have the gene mutation. So knowledge is power and hope, and so it's a really exciting time in medicine because just like this lovely family here told me, they just felt like they're ticking time bombs. You know, people have these family histories and they're like, I'm just waiting for this cancer to get me. But we really find that if we can identify the people we think are at highest risk, offer them options, we can either reduce their risk or prevent cancer. So again, why do we want to test for these mutations? 10% of all cases of breast and ovarian cancer are familial. So it really is a small part. 90% of breast and ovarian cancer, we don't really know why it happens. But for this 5 to 10%, we really are excited about being able to identify it in families and then help to prevent cancer. So of the familial cancers, about 50% of those are related to a mutation in the BRCA gene. So again, just to kind of keep repeating what we think is really important, 1/2 of the BRCA carriers inherit the mutation from their father. So it really is important to look at your father's family history. We talked about ovarian cancer, early onset of breast cancer. And the other thing is you know, sometimes I see families where Grandma Mary had ovarian cancer, and then she just had 2 sons, and they didn't have any cancer, and now I'm seeing the children of one of those sons. Well, that's considered a really limited family history. We don't have women in that next generation to help identify an expression of the gene. So if you have really small family size, we look at that a little bit differently. And I have to say, here in St. John, mostly I see really big families. So, okay. So again, what are the features once we identify a gene mutation? So if somebody has a mutation in the BRCA1 or BRCA2 gene, they're 87% more likely through their lifetime to get a breast cancer. And by age 50, they're 50% more likely to get a breast cancer. And then through their life, they're 44% more likely to get an ovarian cancer. And then they have an increased risk of getting a second cancer. So especially in our women that have been identified to have breast cancer, we think this information is a really important piece of how to treat their breast cancer. And so they have a 27% increased risk of getting a recurrence of their breast cancer after 5 years, a 64% increased risk of getting a recurrence by age 70, and an up to 13% increased risk of ovarian cancer after breast cancer. And again, in men, we do watch their breast tissue. We have men who have a mutation in the BRCA gene have an annual breast exam, and if they have enough breast tissue, we'll do mammograms on them. And so their risk isn't as great for breast cancer, but they do have an 8% increased risk of breast cancer by age 80, and then a 20% increased risk of prostate cancer by age 80. And then a 7% increased risk of pancreatic cancer, and a 4% increased risk of melanoma. How do we manage these risks? So we watch women more closely. We offer them the options of prophylactic surgeries, and then we can give medications to help reduce their risk. And so if a woman comes in and finds out that she has a mutation in the BRCA gene, we can do risk-reducing mastectomy with reconstruction, and we can get a greater than 90% risk reduction in breast cancer. We can't get 100% because there can still be cells floating around, but the risk is dramatically reduced. And then if we take the ovaries out, we can get a 68% decrease in the risk of breast cancer by taking the ovaries out in a woman that has a BRCA mutation, and then as much as a 96% decreased risk for ovarian cancer. So, but we're really good at detecting breast cancer, so women don't have to have a mastectomy if they don't want a mastectomy if they're a BRCA mutation carrier. We can offer mammogram alternating with MRI every 6 months, and we feel very confident that if a breast cancer would develop, we would detect it at probably stage 0 or stage 1 when it's really survivable. We're not as confident with ovarian cancer, so if somebody has a mutation and we ultrasound their ovaries every 6 months and do a blood test called a CA-125, the data says that if we find an ovarian cancer, we probably find it around stage 3. And that's not a very good outcome stage. And so we prefer to talk about maybe getting your ovaries out once you're done having your children. And we begin that discussion at about age 35. And what's interesting is there is data out there that if we take your ovaries out when you're young, and if we give you a small amount of estrogen as a hormone replacement so that your quality of life is still good, we're not increasing your risk of breast cancer. And so it doesn't have to be that you're going to get your ovaries out and suffer. So prevention is just what we're looking at here. And so we definitely love the thought that maybe we're going to be able to prevent breast and ovarian cancer in our highest risk women, are women who have the BRCA mutation. But all women can do really nice things to help prevent breast cancer just in the general population. And so getting annual mammograms is really important, and we're really happy to have Missouri Baptist here providing the free mammogram screening with the van. Our hospital is part of Show Me Healthy Women, and so we can offer free mammograms to women who qualify starting at age 40, and we can offer pap smears at age 35 for free. This is my favorite cartoon. So this is if women controlled medicine, we'd have the mammogram. I really believe in the antioxidants, and chia seeds are the seeds that they used to advertise those chia plants, you know, that grew the hair. Well, now they found that the seeds that they use to grow the hair on those plants are really potent antioxidants. That means they're good for our cell health. They help bring up our good cholesterol, lower our bad cholesterol. They sell it as a supplement at Walgreens in the vitamin aisle. And we just suggest you use 2 to 4 tablespoons a day in a salad or in smoothies or in your cereal. Green tea is an antioxidant. Fish oil, so I'm a big promoter of fish oil. And then there's some really nice data out there that good levels of vitamin D help strengthen our immune system and may help prevent breast and colon cancer. And so there's epidemic low D levels in the population. And so vitamin D is in milk, but you really need about 3 glasses of milk a day to get the amount of vitamin D that we want you to get. It's also in sardines, but not many people are eating sardines, and it's in sunshine. But we're having everybody put sunscreen on now. So we're really advocating for women to take 1,000 units of vitamin D3 every day, and it's a fairly cheap supplement. Lots of good fruits and vegetables, and lots of water. And red wine is good for our heart, but what's interesting is more than 5 drinks a week has been shown to be a risk factor for breast cancer. So everything in moderation. Lots of great exercise. And so maintaining a healthy weight is really important. Studies show that women who maintain a healthy weight don't get breast cancer as often. And what's really interesting is our fat cells have a very weak form of estrogen. And so we think the association is you get a little bit higher level of estrogen in your body if you're overweight. So this is what I'm going to leave you with, is exercise, eat, work, stay happy. And this says don't worry, dance a lot, love a lot, and be healthy. Does anybody have any questions today?
Like as far as if you have a strong family history of breast and ovarian cancer, we might want to look and see
Or fibroid tumors,
so thyroid tumors, that's where family histories get so interesting.
Yeah, 'cause
Fibroid,
we have fibroid.
yeah, but those are benign, but if you have, so you guys are asking good questions, but there's a syndrome called Cowden syndrome that's associated with a lot of different tumors. So benign fibroids, cysts on the breast, cysts on the thyroid, but it's often associated with a really big head. So if you go home and measure your head, and your head measures bigger than 58 centimeters, and then you have these family histories with like fibroids and cysts, and we should talk about that. It's kind of interesting.
Years ago, they didn't talk about cancer.
No, that is exactly what that is exactly right. So then we look for really young deaths, and if they say, well, grandma died in her 20s and she had something, but we're not sure what it was, that we kind of look at that a little bit more closely. And if we see in subsequent generations there's more breast cancer, we look at that young death as maybe that really was a cancer death. Any other questions?
I just have one. I just recently read it or saw it, that taking all the vitamins sometimes prevents your body from making vitamins. Is there anything to that?
Well, I don't know. So that's what's so interesting.
Yeah.
So forever I have told women to take calcium supplements for their bones.
Right.
Well, recently they came out with a small study that said maybe calcium supplements increase a woman's risk of heart disease. Well, it's one small study. We're like, what do we do with this information? But calcium's easy to get in our foods, yogurt, cheese, dark leafy green vegetables. So what I tell women is, well, let's try and get it in your food, but you have to be vigilant and you have to be honest with yourself. And if you're not getting 3 servings a day of something with calcium, then you need to take the calcium supplement. So, and then the vitamins and minerals. So some of the new studies say that I heard say that they just aren't benefiting us. Like people, so they're not good, but they're not bad. But what I say is look at your diet, and they really recommend 9 servings a day of fruits and vegetables, and a serving is a half a cup. So if you're just not routinely getting that, and it is best to get it in our food, but if you're not getting it in your food, you take the vitamins.
Thank you very much.
Have a great day. Thanks for coming.
Thanks, Mary.
Thank you.